For shelter puppies, we do have a recommendation that is different than we do for pet dogs, simply because of the high risk that those puppies are going to be at in a shelter, because I would venture to guess that there isn't a shelter in the United States that doesn't have parvo in it, and I would say that 99% have distemper in them. So those virulent viruses are there waiting to find a susceptible puppy, and we want to, of course, get to that susceptible puppy and immunize it before it gets infected with virulent virus. So we recommend starting the vaccination program as early as 5 weeks, and even in a situation where there is an outbreak, for example, of distemper or parvo, we would recommend starting at 4 weeks, no earlier than that. If you get a puppy much younger than 4 weeks of age and you start using these vaccines, the vaccine virus can actually cause disease. The earliest age, as I mentioned, would be 4 weeks of age, and then we recommend every 2 weeks up to 18 to 20 weeks of age in a shelter environment. That's in contrast, of course, to recommending not starting before 6 weeks, and preferably 8 weeks for the puppy in a home environment, the pet puppy, and really finishing between 14 to 16 weeks or 14 to 18 weeks for the last dose. So we are reducing, of course, the number of doses, thus reducing the likelihood of developing these immune responses to some of those vaccine antigens that we really don't want to sensitize the animal to. So it might seem unfair, but it's really not, because if we don't have that program for the puppies, we're lucky if we have any puppies that don't get infected with distemper and parvo.